Today, I would like to go into detail about the endoscopic brow lift, a surgical technique that helps soften the face and create a more youthful appearance for some patients in the LGBTQ+ community who do not want their face to look overly feminine. The endoscopic brow lift can be a good option to soften a stern or harsh-looking face without the need to undergo full facial feminization surgery or structural facial bone procedure. One of the key reasons why endoscopic brow lift has become very popular is that all surgical incisions are completely hidden within the scalp. People around you may notice that you look better, but they will not be able to tell what procedure you have had. The step of endoscopic brow lift surgery can be explained simply in 4 main steps. Step 1. Small incisions are made. A total of 4 incisions, all hidden within the scalp. These incisions are placed slightly above the hairline and are not visible from the outside. Step 2. This involves deep tissue dissection in a layer called the subperiosteum plane, extended down to the upper border of the eye socket. This step releases the forehead and brow from the underlying bone, allowing them to be lifted freely. An endoscope is used during this step, with the camera lens transmitting images to a monitor for precise visualization. Step 3. The brow is then lifted to an appropriate level and shaped according to the desired contour. A well-designed brow lift technique will create a naturally elevated and gently arched tail of the eyebrow. Step 4. A fixation device is applied to the scalp to act as a locking mechanism, allowing the lifted scalp tissue to be suspended and maintained at the new brow position. The fixation material may be a resorbable device such as endotine or permanent option such as a titanium screw. The choice of fixation method is determined based on the individual patient's condition. When endotine is used, this device is secured to the scalp and functions like a small hook. It supports the lifted tissue and locks the eyebrow in the desired new position. When a titanium screw is used, the threaded portion of the screw is completely embedded into the scalp. Absorbable suture is then used as a sling to suspend the lifted tissue onto the head of the screw. One limitation of endoscopic brow lift surgery is that it may not be suitable for patients with a high hairline, as a hairline may be elevated further after the brow lift. Additionally, endoscopic brow lift cannot be combined with the scalp advancement surgery, which is a procedure designed to lower the hairline. This is because scalp advancement pulls the scalp forward to lower the hairline, whereas endoscopic brow lift lifts the tissue backward, resulting in opposing direction of tension. I will explain scalp advancement in more detail in the next video, so please stay tuned.